Hi guys, it's me again. Today I'm not talking about medical tourism case. It's about a recent post that I've seen on social media that really shocked me. It's about someone's family member has been diagnosed cancer in New Zealand, and unfortunately, this patient passed away within just 1 month. It brought me back a lot of memories from Canadian healthcare system. And going through the whole timeline of this patient from New Zealand, I do think there are points that could have been done better. The appointment was delayed because the specialist went on vacation, and the patient's family was trying to ask the house officer for an earlier appointment as the patient has been diagnosed in cancer. The house officer was being passive aggressive to the patient's family, and the patient didn't get an earlier appointment at the end. It reminded me of one of the doctors from my previous job who was going through a tough mental time, and he started getting late around 30 to 1 hour. He also doesn't stick to the appointment time, ignoring the clinic's policy, for example, only one issue per visit. And then he began start canceling his days 20 minutes before his day started. And many of his patients were elderly and do need regular follow-ups, so they can't book an appointment with him for at least 2 months. As a medical office assistant, what we can do is only apologizing. But since I've been working in that clinic for a long time, I also work in other locations, and I am also familiar with the colleagues from other locations. So I was actively reaching out to them to seek for their help and trying to get all these patients sooner appointment to see a GP for a diagnosis or a follow-up. Um, that's why when I'm coming back to China, I also choose to work in the cross-border medical services because China is famous of its efficiency in healthcare system. We can offer a second opinion right after their initial diagnosis. Maybe you can give the patient one more chance, and that might be life-saving. All right, so that's all for today, and I'll see you next time. Bye.